Hey guys, welcome to Cultured. It's your girl Bromley, and today we're back with one of my favorite guests, and I can't wait for you guys to hear what she has to share. Like I said, guys, we're back with one of my favorite guests, and the last time she was here, she spoke candidly about her experience as a new foundation year one doctor. And we're just here to catch up with her and see what her journey has been since then. So say hello to the beautiful Lola, guys.
Hi everyone. How are you, Bromley?
I'm good. How are you doing?
I'm good.
Oh, awesome. I was able to catch Lola because she was here in Sofia, Bulgaria for a week and she's leaving tomorrow. So I'm lucky to be able to, get her to sit with me and do this podcast. And honestly, I heard a lot of feedback about how you are so honest in the last episode. And that's the kind of content people want to hear, because it's easy to say oh, my experience was good, everything's great, but you were always, and that's her in real life even. She's very honest and very, very, very genuine.
Thank you.
So perfect. So I wanted to ask you, how do you feel now after, I don't know, I think it's been 6 months. I don't know.
It's been a year.
A year?
Or maybe 10 months, I think.
10 months,
8
maybe.
to 10 months.
Oh, wow. That's crazy. Oh, and how has it been so far?
To be honest, now I can say I'm truly settled and it is good.
Wow.
Yeah. Now I can understand why people are don't worry, it'll be fine. Because although it's very, very crazy and you feel did I even choose the right profession in the beginning? Once you get used to it, you get used to it. And it's not getting used to it in the sense of, oh, I now know everything. It's almost getting used to the sense of, I know nothing. I will always need to ask for help, and I'm okay with that.
That's amazing.
And then once you're in that state, and know that that's what you're probably going to experience. It might not be every day because you get used to the system, but it might be once a week. When you get that feeling, you just deal with it in a calmer way. And it's just, you're just used to it. You're used to being in positions where you don't know things. You're used to asking for help. You're used to knowing some things. And then over time, you see yourself growing. So it's good, and it does get better.
Wow.
That's where I'm at the moment.
That's the best advice ever. It's not about it's not like you're the best, but to know, to just be comfortable in that space.
100%. Yeah.
Oh, that's amazing. What would you say, since you started, some things that you thought in the beginning about yourself that is not true? Preconceptions you might have had.
I used to think that I was not good I had really bad imposter syndrome. I used to think I was definitely not good enough to be a doctor. I used to think 100% I don't know what I'm doing. And I think what was bad at the beginning was I internalized that quite a bit. So it did affect my mental, and it just made me not want to be doing medicine. It made me just want to leave. It just really affected me personally. Whereas now, it doesn't. I realize a lot of people don't know things, and it has no implication of how you are as a doctor. It doesn't speak to your self-worth. It doesn't really mean much. The things that I used to think that would get me down and make me cry and make me sad and just make me feel like the worst, just don't anymore. And I realize really, truly being a good doctor is being there for your patients, and the amount of medical knowledge you have in your head doesn't actually mean much when it comes to how you relate to your patients. I've had patients that I've had really sweet compliments for, and I've seen literally a surgeon who's the head of a department. He's the top surgeon. And he literally came to the ward to speak to one of our patients who had cancer. And after he finished speaking to her, the patient was crying, devastated, unable to speak, because he basically just told her she had incurable cancer, not knowing that she didn't know that. He just blurted that. Do you know what I mean? And it's that's someone that knows everything. It's a consultant, the director, do you know what I mean?
Yeah.
But obviously being such a busy man, just rushing in, telling patients, he's probably got a lot of patients to see. So it's just telling people different things and walking out. And that's someone who has a lot of knowledge, but still that personal skill wasn't there in that moment. So it's like might have all the knowledge in the world, but that doesn't mean much when it comes to how your patients see you and how you are as a doctor. So I feel like knowing that and just being there for your patients, being honest when you don't know, finding out the answers is what makes you a good doctor. Because over time, when you keep on searching things you don't know, you'll know them. And then you still have that personal skill with your patients that makes you a good doctor as well.
Wow. Wow, that's awesome. So encouraging, by the way. Like, even for myself, like I'm hoping to make that transition soon. So like for me, like I have like a gazillion questions, I'm sure for you as well, when you wanted to start up.
100%.
So like, what would you say, like, now that you see yourself back, like you're like, okay, I was there, like where Bromley's at, where she's going to transition now. What would your best advice be to the people who are transitioning into that FY1? Are you FY2 now? FY2?
Technically, well, FY2 SHO is technically what I'm doing at the moment.
Okay. Yeah. So what would be your advice for someone who's starting off, and if there is something that you would have done better starting off, what would it be?
Learn ECGs. I'm joking.
Really? Okay, on it.
The thing is, I just feel like there's no amount of preparation that can prepare you.
Okay.
A lot of it is just being in the hospital and, you know what I mean, gaining and growing from your experience. I would say once you're starting, things to bear in mind is less even procedural things, but knowing when to ask for help and being confident in asking for help. Also, I think the main thing is also just understanding your trust guidelines. Like, it took me a while to do it, and I do it a lot now, which is something I didn't do when I first started working. Like, when I first started working, if somebody had something, I would just freak out what to do. I don't know what to do. Freak out. Whereas now in my hospital, okay, like hyperkalemia, for instance, like I know roughly the treatment, but anytime I see a patient with it, I'll just go on my trust webpage, type in hyperkalemia, see the guidelines and follow that to a T. So being able to use your resources, so knowing where your trust guidelines are, using the BNF when you need to prescribe, downloading Pocket Doctor, because that will tell you what to do in every situation. If somebody says, my patient has a high respiratory rate, you can literally go on Pocket Doctor and see what to do. And Pocket Doctor will tell you what to do from start to finish, including when you should call for senior help.
That's awesome.
So I would say my advice would be get the relevant resources you need to help to start. Be mentally strong. Know you're going to fight, and it's going to be an uphill battle, and it'll be dark at first, but it'll get better. So mentally strong, knowing your resources, knowing when to ask for help. And then also like medical knowledge and studying isn't going to hurt you. So study as much as you can, but it's not the be all end all. Do you know what I mean?
Yeah.
Like knowing which receptors and which does this isn't always going to help you, but just having the basic medical knowledge will.
Wow, that's awesome.
Yeah.
And I wanted to ask like a very like just this question just popped in my head, like, you know, like now that you studied in Bulgaria and you went there, do you see like I think I'd go for this first question first. I would say, like, do you see a difference between like the British students there and like the students, let's say, who are coming in from Bulgaria? And are you treated differently, or how you approach things, is it different? Like,
I would say I've not been treated differently at all. Like, I don't think people even know I studied in Bulgaria unless I tell them. Personally, I do notice a difference between the UK medical students and Bulgarian students. I feel like they're very well practically trained. I feel like Bulgarian students are very well theoretically trained. Like, we study from textbooks here. They study from multiple choice questions, you know? But they are very practically trained. So in terms of physical examinations, how to do a complete neuro exam, they're quite like, they've had that ingrained in them for first or second year. However, that's not something that we can't learn. Like, I don't have the best neuro examination, but if I wanted to just now go on Geeky Medics, find out a neuro exam, and anytime there's a patient in my ward, do a neuro exam on them, then I'd be good at a neuro exam and I'd be on par with the British student. Do you know what I mean? Like, I feel like there might be slight differences when you first start, but ultimately Whether or not there'll be a difference is down to you as an individual and how much you want to do. So if you know you're working on, for example, you know you're going to work on a cardiology ward, and you know that they probably have auscultated 1,000,001 times and we haven't, or they've looked at 1,000,001 ECGs and we haven't. Nothing stops you from staying after work and auscultating. Nothing stops you from telling your consultant, if you hear a heart sound, can I hear? Nothing stops you from saying to your reg, oh, I'm going to listen to this. I'm going to do a full cardiovascular examination. Can I present it to you? Yeah. The more you do that, like the better you'll be. And eventually, like if you do that more than others, you'd be better than a UK medical student. So the whole Bulgaria versus medical students, you might see differences, but you only see differences if you're not making the changes you need to make. If you make the changes you need to make, then you won't see the difference.
That's awesome. Yeah. I'm gonna print that and put it on the wall.
I think it's the same for them as well. Like we might be more textbook trained, and it's like if they see, like it's like that's how they actually are. Like when they see, like say like I know something, which because I worked a urology rotation. If you've not worked a urology rotation, which is the male genitals and female genitals, you won't know the practical procedures. So I've seen a patient, because I've done urology, I know how to do a 3-way catheter, and I put a 3-way catheter in and I've come out, and a UK doctor who like did medical school in the, so a doctor who did medical school in the UK was like, oh, how did you do that? And I just explained it to him. That's really what the hospital environment is about, seeing what you don't know, asking, and then trying to do it the next time. You know, and I feel like you don't see, once you develop that mindset of always trying to learn what you don't know, you won't see any difference between anyone else.
That's awesome.
Yeah.
Wow. And like, is this true? Like, you know, people say like, you know, the nurses like are your best friends in terms of like
100%.
Yeah.
100%. I'm lucky. I've never had a nurse that I don't get along with. Like I've gotten along with all my nurses. Like for like the first 6 months when I started, I didn't know how to do a cannula. Never performed a cannula because I didn't want to do one because I didn't know how to do one. The nurses would do it for me. It just got to a point where I just said to myself, I'm going to need to learn how to do these cannulas because I don't know how to do them. And then I watched some YouTube videos when I went home. And then when I was next called to do a cannula, rather than asking my nurses to help me, I just took the plunge and did it. And I flopped it multiple times until I didn't anymore. Do you get what I mean? And I feel like that's just what the hospital is about. You try, you try. I've seen UK medical students, like I think somebody was needing an injection on the bum. There is a medical term for it. I just don't know what it is. It's like a subcutaneous injection on the bum. Okay. And the guy was like, is there a special procedure for that? Or do I just... And he quickly went on Geeky Medics. I was like, okay, let me go try. And I think that's what the public don't really know is what it is behind the scenes. It's literally like Googling and literally just figuring it out. If it's beyond your depth, asking for help. And that's just really like that's how it goes. Yeah. And the nurses will always help you, including the outreach team as well. So just ask them, like I've asked multiple times, oh, I didn't know how to do this. Do you know how to do this? Can you show me? Yeah, I asked nurses, like when I was trying to learn cannulas, can you show me? And they would show me. I asked, like I did a respiratory rotation. So the respiratory nurses were excellent at ABGs. So I just asked them to show me. And the friendlier you are to them, the more they're willing to help you without you asking.
That's awesome.
Yeah.
And like, have you had ever like some trouble with patients where they're upset? Like, let's say you said like, you messed up a little bit. Do they get angry or?
No, that's the thing. That's the thing. I've never, or maybe once, but majority, I've never had a patient be like, you've made a mistake. I don't want you to do it anymore. I've only had one experience with that. And that's like a year into working. And I think it was a very particular patient who he had a respiratory condition, so therefore he always needed ABGs, which is the blood test in the wrist where you stick the needle through the wrist to get arterial blood. And he knew he was difficult to bleed because he obviously has the condition, he just knows. So he basically said to me, I'm difficult, have you done an ABG before? I said, yes, I have. And I proceeded to do one, didn't get it, proceeded again, and I didn't get it. I was like, okay, let me just try a third time. He was like, no. You've had your 2 shots and that's it. Okay. And I guess it's like, I've had an ABG before. I know it's a painful procedure. So it's just like, you just take it on the chin, you know? Yeah. The next day, I was still his doctor and he needed another ABG and he was happy for me to do it again. And then I got it first try. Yeah. So it's just like, sometimes you get patients that are a bit like, no, you're not going to do it again. But you can understand from their point of view, like these are painful procedures. They might not want it 1,000 times. never take it as if like imagine somebody was piercing you multiple times, you wouldn't like it. So it's just like understanding that they might be fed up, they might be tired, and just letting it go. But most of the time, patients are happy for you to try. Patients are happy for you to remove their drains, do procedures. They're okay. They just need reassurance. I feel like patients more or less need reassurance in the procedure itself rather than the person performing. So they're like, their main worry is it going to be painful? Is it going to be this? Is it going to be like this? What's going to happen after? Rather than how many times have you done this? Da, da, da. Do you know what I mean? Maybe for more detailed things like performing surgery and stuff like that, they might be a bit more wary. But the procedures we do as junior doctors, taking bloods, ABGs, catheters, it's it's a bit more. They're a bit more chill.
Wow, that's amazing. And I wanted to ask, like, is there any don't do's like in the hospital environment that?
How do you mean?
I don't know, in terms of like maybe with how you deal with patients or with your, let's say, your consultants or your seniors.
So there are a few like, Now in terms of actual practice itself, there are a few don't do's. For example, like they say never mistakes. So you kind of would want to know what the never mistakes are. And those are mistakes that should never happen. E.g., if a patient has an NG tube, if the nurses, they take a sample from the NG tube, which goes, it's a tube from the nose straight into the stomach. They take a sample. So once it goes into the stomach, they take a sample, they aspirate, so draw up some, and they just test the pH because we know the stomach is acidic. A lot of the times, or some of the times, they can't get the pH. So they'll send the patient for a chest x-ray. And you have to look at the chest x-ray and see if it's in the lung or if it's in the stomach.
Okay.
And that's a never mistake. So you never want to say it's in the stomach if it's not, because it can cause some like death. So there are never mistakes like that, like mistakes that you should just never make. In terms of how you are with your consultant, I just say be respectful. There is not many don't do's. Just be, as long as you're professional, respectful, polite with everyone you work with, it's fine. It's fine to tell a patient you don't know the answer to their question if you don't know it. I would say a don't do should be don't lie. Because we have a duty of candor, which is we have to be honest with our patients. It's very, just be honest and say, I don't know. I'll find out and I'll get back to you. That's what I say all the time. Literally, like, it's my go-to, especially when I have patients that ask, or patients' families that ask a lot of questions and it's beyond me. I don't know.
Yeah.
I'll find out and I'll get back to you.
Wow.
Yeah. It's very simple. There's not much to it, but me being there, I do understand how much we overplay it and hype it to ourselves that it makes it worse than it actually is.
Okay. Yeah. Like, do you think you might have had like, I don't know why I'm focusing on like bad experience. I want to see like how the extremes are, let's say. Like, have you had like a consultant be like a doctor be angry with you because of something you did? Or is that not a norm, like in
the thing is, it's funny you say this because I've worked with people and they were telling me how terrible consultants can be. And I just feel blessed. I've just never had...
So good.
I've never had a consultant shout at me or tell me anything. I have had a few regs be a bit like... Because I think I was once on a surgical night shift and the reg told me to put a Riles tube in. And I didn't know what a Riles tube was to even proceed with putting it in. And I just said, like, I can't put it in. I've never even done one of these before. And he was like, how many years have you been a doctor? And I was like, well, I'm just an F1.
Yes, that's right.
So it was like,
joke's on you.
Yeah, so it's like, and he just did the procedure. So you might get a few snarky doctors like that, but I've never had any talk down to me. I've never had, if I've cried because I felt overwhelmed. A doctor's never made me cry.
Yes, I see. Okay. Yeah. Do you find yourselves in moments of like being overworked? Like over like
Okay. I think understaffing is a real problem in the NHS. That was an issue I've experienced on my current ward in my current hospital where we have 19 medical patients, and medical patients are different from surgical patients because if you think of it, a surgical patient has to be fit enough to go for surgery in the first place. Whereas medical patients, they can be as unwell as can get. They can deteriorate like that.
Okay.
And I think I had 19 patients. Usually in my ward, there's 2 junior doctors. So we split it like 10 and 9 patients each. And then we have a consultant who we can escalate anything to. Now we have a registrar, which is great. But at that time, I was the only one on the ward.
What?
Yeah, and the consultant doesn't stay on the ward because he's just there for you to call. And I think a lot was going on. I think I had a couple of patients deteriorating, and it's just very difficult because one deteriorating patient, all your attention goes to them. So how do you do the other jobs of the day?
Wow.
And then the hospital were pressuring us for discharges as well. And it's like, I don't have time to write a discharge letter when I'm the only one here. So I've had a few moments like that where I get stressed. But I just escalated to the proper channel. So I did say, like, this is not on, like I won't be working like in these conditions. And they listened and they brought another junior doctor and they even gave us a registrar as well. Now there's like a team of 4 on our ward, which is nice.
That's amazing.
Yeah.
And I've basically been reading about this test. It's called an SJT. Like it's like a situational judgment test. It's like something that you have to and they bring up a lot of like this
scenarios.
And teamwork and things like that.
100%. Yeah.
Have you had to like confront like people in your team about or
No, but I've seen it being done, but I've never had to do it.
Okay.
So I have seen in board round or handover, which is when basically the team before handover to the new team. So they let you know if there's anything going on. And every morning, the day team will have a board round with the nurses, where the nurses hand over to us if any patients were unwell overnight, things like that. Like maybe this patient's been deteriorating overnight. So that after board round, we know who we need to go and see first. And I think there was a case of a patient was really hypoglycemic overnight, but it wasn't handed over to the doctor. So I saw the doctor say, this is kind of not great, because sometimes it might not be that medication has been started. It might just be like, this patient is hypoglycemic, hand it over to the doctor. The doctor will review and start the appropriate medication or give glucose or whatever. Okay. And because it wasn't handed over, the doctor didn't know to do it. So the doctor did the ward round as normal. And then when he came to her, he realized she was so hypoglycemic and was like, why wasn't this handed over? And like, this is not on. So he just went into the office with the charge nurse and said, look, like, this wasn't handed over. Can we please hand over like important information so that we can see the patients appropriately? And it was that done easy. Yeah.
That's awesome.
Yeah.
I mean,
so you see it like things like that are things that come up in the SJT. Like, how would you be in a difficult situation? How would you confront somebody? How would you be with somebody who's being rude? It's just these things like that, really. Yeah.
Yeah, because there's this like job opening, and I was like, and it's really good scenarios because I didn't even think these are things that I need to worry about.
No, yeah.
Because you're like, oh, somebody was crying, so what do you do? And like, how do you like patient confidentiality? And it's like, these are things that like you can't really train for it, like unless
and it's like it's even even that patient confidentiality thing. It's even like the list of things. Like in our ward, we do board round like in the middle, and we have bays. And it's like a little thing where I noticed other people doing it. They close the doors of the bays when we're going to do ward round because we discuss the patients. So it's so that other patients don't hear about other patients.
Yes.
So confident, like you see this in your daily practices, but when you're studying for the SJT, you're just a bit like,
why does it matter?
It does come up, not all the time, and not as dramatic as it is in the SJT, but it does come up in little things like that.
That's awesome. Oh my gosh. And like, what has been some of your like best experiences? Like now that you're like 1 year?
Honestly, I think I had my favorite experience recently. So you know how at the beginning it was a dark tunnel, hated it, didn't know what to do. And then I started working with one of my friends as well from Bulgaria. And
wow, amazing.
Yeah. And she started, so I've been working for just over a year now. Whereas I think she started a few months ago, really. So she's been working 2 or 3 months. And we were on the ward together, and there was a patient who deteriorated. And I could see how she was panicking and stressing, and like, even sometimes you know what to do, but you just panic because you see a patient like that's well and fine, next you know, requiring oxygen to the max, becoming very drowsy, not alert, all of these things. So I could see her panicking, running, calling. And when she was speaking on the phone, like she was like, not really saying, like she was speaking on the phone to an outreach team, which is like a specialized nurse for when patients deteriorate. And then she was like very frantic, like I took over the phone and just re-explained the patient. And then the nurse was like, your colleague didn't even tell me the patient's name. So I saw like how she was fighting. So I was like, okay, let me take over. And then I just basically went to what I would normally do, which is basically your A, B, C, D, E. And I was like, A, airways. Is his airways patent? Yes. B, breathing. His breathing is off. Something's going on in his lungs because he wasn't needing oxygen. Now he's needing so much. What are the things that can cause you to require more oxygen? I thought, okay, a pulmonary embolism, if he's had a pneumothorax. So I said, okay, let's rule out a pneumothorax. Let's order a chest x-ray. Came back clear. I said, okay, let's send the bloods for a D-dimer to see if there's a pulmonary embolism. Okay, came back clear. I'm thinking, okay, what else? Then I asked the outreach nurse, like, what else do you think it could be? She was like, it could be mucus plugging. It could be COVID. Let's do a rapid COVID test. Do you know what I mean? Like, I took a breath. I told my friend to calm down. And I started going through it step by step. Okay, mucus plugging. Maybe I think he had COPD and a bunch of other stuff. And so maybe there was just excess mucus blocking his airways that's causing him to need more oxygen. What they then did was then called the respiratory physiotherapist. Can you come and see my patient? Then I just went quickly through circulation. What could it be? His blood pressure's fine, heart rate's fine. I don't think there's anything going on in his circulatory system. D, is his glucose fine? His GCS score is slightly decreased. E, exposure, everything fine. Then I thought, okay, there was a respiratory reg on my ward, coincidentally. I said, can you just review this chest x-ray? He said, okay, I don't think it's a pneumothorax. I don't think it's anything like this. I said, okay, let's do an ABG to see what it would be. We saw that he was in type 2 respiratory failure, so he was going to need some ventilation. I basically just went through it like that, step by step, came up with a plan and like knew what to do from there. And not that, like, I just know my friend was being like that, but just because that's just how it is when you first start. You're frantic, you don't know what to do, you think somebody's going to die in your hands. And then so working with her and knowing what to do in the situation, even though I asked multiple times for like advice from other people, just showed me my growth over the year. Yeah. And I feel like that, like I felt really, really, really good after that.
That's awesome. Oh my gosh, that is so good. That's so practical.
No, yeah, literally.
Oh my gosh, thank you so much for that. That's so
yeah.
Oh my gosh, and that's like your day to day. Like, you know, you have to.
Yeah, but patients don't usually deteriorate, and usually there's been a reg on my ward, so he'll do the whole ABCDE thing. I'll document and I'll help. So it was the first time that the reg was ill, and I did it myself. We documented, and I was like happy with my plan. Awesome. And I felt like, and that just showed me like my growth from the beginning where I remember my first time I experienced that, I was calling all my friends, I was crying and I was just frantic, to now. And I think that's just the best thing about being a doctor. You just continually learning and you see your growth. So yeah, that's been my favorite moment.
That's excellent. Yeah. Oh my gosh. Oh, God bless you. Like, I pray that you get like even more successful in whatever you do.
I do hope so.
That's amazing. And I wanted to ask you, like, in terms of like your free time and things like that, like, I'm sure people would love to know, like once you start like this foundation year one job, has your free time, or has it, like, do you have much more free time now because you're, you know, maybe you've gotten used to the rhythm of life? Or
so my first job was very close to my house. However, I was doing long days, nights, and on calls. So the free time was normal. However, I can't really judge my free time now because now I'm doing my master's as well. So it's like I don't really have free time because I'm doing a master's on top of working full time. Yes. But I feel like if I didn't do my master's, I'd have more free time.
I see.
I feel like you can make time for things. Like, obviously, with the schedule of the doctor, nights and stuff, you have to kind of schedule around. But you can make time for the things you love. Like, I'm just working I've changed my contract to just 9 to 5 Mondays to Thursdays because I'm in uni as well at the same time on Fridays and after work. So I still have free time. Like, I still do stuff. Like, I'm skiing right now.
That's awesome.
I'm on a skiing holiday. Yeah. So free time, it's nothing to worry about. The only thing I would say is you'd find yourself getting more tired when you get home from work. Yeah. But it's all about like doing the things you love, doing hobbies and making time for them.
It's awesome. Yeah. And like, so your offs are like, do you get like offs 2 days a week?
So the thing is, I'm kind of like locuming now. So I'm not like,
nice.
Yeah. I'm locuming at the moment because even though I was offered a job to stay at my trust for an FY2 position, I couldn't do it because they wouldn't give me Fridays off. Okay. So my contract right now is just Monday to Friday, 9 to 5. And then I'm in uni on Fridays.
Okay.
Monday to Thursday, 9 to 5, and then uni on Fridays. But yeah, wait, remind me of your question.
Like, do you get do you get more free time now? Now, because, initially when you start off, it's like you feel like your work probably takes up your entire day because
It's like
first of all,
that.
you start off new and then.
Yeah, but it doesn't get better.
Okay.
No,
Okay.
it's the same. It's the same because you're doing nights. You're always going to be doing on calls unless you're going to do a GP rotation, a psychiatry rotation, ophthalmology rotation. The rotations are 9 to 5. If you're going to do a medical or surgical rotation, it's not going to stop. But it's just that maybe you're less tired after your shift, or the thing is, I think even my friends who are pharmacists have told me, like, when they first started working, it was a lot. And it's just like, because you're getting used to working and it's draining and tiring, but then after a while, you just get used to it.
Yeah.
So, and it's like, you used to it, like, maybe at the beginning, you're too tired to go out for drinks with your friends, but a year in, it's just a normal 9 to 5. You can go out for a drink with your friend or for dinner. You just get used to it.
You get used to it.
Yeah, but it doesn't stop. Like, I can't say, because locuming isn't the normal pathway. I'm only locuming because I'm doing my master's degree. Once I finish my master's degree, I'm going to go back to the nights on calls. But it's just, it's just work. Yeah. It's adult life. It's adulting, working and making time for your friends.
Wow. So proud of you, Lola. Like, kind of how that's awesome. And like, do you find yourself getting excited to go to work now? Like, oh no, not really, no.
I mean, it's still work, but I do realize, like, I like my job.
Yes.
Like, I hear people complain all the time, I hate my job, blah, 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 blah. Like, I don't hate my job. Like, my job is really interesting. There are the mundane parts, which is documenting every day, doing discharge letters every day. But the fact that I can see new patients every day, random patients, see people with blood test results that even consultants have never seen before. It's interesting.
Yeah.
It's interesting. And the thing I love about medicine is you'll never know it all. So you're always learning. And I like that. Like, I like to be challenged and I could always do more and learn more. So I don't look forward to it, but I don't particularly but I don't want to say I enjoy it. I'm not the overzealous type, but I like my job. I like going to work. Like, now I haven't been at work for a week. Like, it's like, I'm not dreading going back. Like, I'm happy to go back to work when I need to go back to work. Do you know what I mean?
I
It's
see.
Yeah.
That's awesome.
Yeah.
Oh, I think that's been amazing. So much in, like, you should see my face, guys. Like, I'm like literally trying to soak in everything she's saying. So I know for you might think, oh, I'm just sharing my experience, but it actually is so helpful, super encouraging, and like how you are, like, I'm so honored to know you. Whenever you're back in Bulgaria, or maybe I'll catch you in the UK.
Yes,
who knows?
When you come and join us in the UK and start working,
I'll come pop by and we'll do another episode.
We'll do it'll be a reverse podcast. I'm asking you your experience and how you're finding it.
Hopefully, I'll have good things to say. But no, but thank you so much. I wanted to just like appreciate you. You've been so responsive as well. Whenever I've asked her, she'd be like, yeah, I'm coming to Bulgaria. We'll do it in person. And
no worries.
I just want to say thank you. And I just pray a blessing over everything that you're going to do and your master's. Like, what are you mastering in?
Endocrinology.
It's awesome.
Yeah.
It's awesome. That's something that you've always liked.
I have Graves' disease. So yeah, interested in it because of that, really.
Because of that.
Yeah.
See, you never know how God, takes you in that path.
Yeah.
But I wish you all the best. And thank you so much. And guys, thank you for listening. And if you have any more questions you'd like me to ask Lola, please text me, let me know.
Send it through our way.
Yes. Thank you guys. And until next time, bye-bye.
Bye, guys.